What if the US guaranteed health care for everyone, without banning private insurance or breaking the system? Modeled after France's universal health care system, every American would be automatically enrolled in a public health insurance program that covers essential care, primary and preventive services, emergency care, hospital stays, maternity care, mental health services, vaccines, and essential medications. Coverage would be universal and portable, no longer tied to employment. Patients would be free to choose their doctors and hospitals, with no denial of care based on insurance status. Care would be financed through a restructured system of payroll-based and progressive taxes, replacing employer-sponsored insurance premiums and most out-of-pocket costs. The public system would directly reimburse providers at nationally negotiated rates, dramatically reducing administrative waste and price inflation. For medically necessary services, patients would face little to no point-of-care billing, with modest cost-sharing cap to protect affordability. Private insurance would not be banned. As in France, it would remain widely available as optional supplemental coverage, helping cover co-payments or offer additional conveniences, while the public system guarantees comprehensive baseline care for everyone. A strengthened network of primary care practices and community clinics would emphasize prevention and early treatment, while hospitals would be funded based on patient needs rather than profitability. Doctors would largely remain private practitioners, preserving professional autonomy and patient choice within a publicly regulated framework. But achieving this requires confronting a central obstacle: the outsized influence of PACs and corporate money in U.S. politics. France's system succeeds in part because healthcare policy is treated as a public responsibility, not a profit-maximizing market. In the U.S., insurers, pharmaceutical companies, and hospital conglomerates spend billions through lobbying and campaign financing to block reforms that would reduce administrative waste, cap prices, and weaken their market power. As long as these interests dominate the political process, even widely supported reforms face structural resistance. Ending PAC and corporate money in politics would realign policymaking with public interest rather than donor influence, making it possible to implement a French-style system that prioritizes access, affordability, and outcomes over shareholder returns. Healthcare reform, in this sense, is inseparable from democratic reform. The result would be universal coverage, the elimination of medical bankruptcies, lower overall healthcare costs, greater economic mobility, and a system that treats healthcare as a social guarantee, accessible to all, independent of employment or income, and governed in the public interest rather than by corporate power.